Let me go to the next question. My number of hygiene days is static and has been for a number of years. How do I know when to add more hygiene days?
Great question. And that's true of so many offices. I'm astounded by how many dentists I meet. I say, tell me about your hygiene department. Well, we've got one hygienist who works 4 days a week, and they've been in practice 20 years. And these, 20 years ago, we had one hygienist who worked 4 days a week. What's wrong with this equation, Darren?
That means that practice either is not getting new patients or like every new patient who walks in is walking out.
The back door is wide open.
Yeah.
We got to close the back door.
Yeah.
You should be growing every year. You should be growing every year. So there's a number of ways that you can answer that question. You can answer it mathematically, Naren. For example, Naren, I'll ask you to do some math with me as we go.
Sure.
Just confirm that the math equation that I'm putting together makes sense.
Yeah.
In a perfect world, we like to have 85% of our active patients involved in regularly scheduled recare.
Okay.
85%. Notice I didn't say 100, Darren. And I
Right.
didn't say 100 because it's not realistic.
And regular
So-
recare is like 2 times a year.
Again, assuming they're healthy, it would be twice a year.
Okay.
And of course, that's a big assumption because we know that a big percentage of the population is not healthy and they need to be seen more than 2 times a year. So it just gets better if we use the 2 times a year. So run the math for me, Naren. 2,000 active patients,
Okay.
85% of them involved in active recare. How many patients do I have in active recare?
1,700.
1,700.
Yeah.
85% of 2,000.
Right.
Okay. And now assume, so now that's the goal. We want 1,700 and assume that we're seeing a healthy adult for an hour appointment. So 1,700 divided by 8 hours. How many days of hygiene do I have there? 1,700
Well,
divided by
well, you have to multiply 1,700 by 2, right? Because they're going to come in 2 times a year.
or take that number and multiply by 2. So yeah, we're going to get
Oh,
to
okay.
that.
Okay, got it.
Yeah.
So it's just divide 1,700 by, you
8.
said 8. So I guess that's around 200 and something. 200 and,
Let's do it exactly.
okay.
So 1,700 divided by 8, 212.
212. Okay.
Yeah. But now we're going to multiply that by 2 because we see them twice a year.
So
400.
400.
425.
Right. 425.
425. So now we know what the potential is. And what does that tell us, Naren? That tells us
How many hygiene days you need, right?
how many,
425 hygiene days.
yeah. And so if I look at a full-time hygienist as
So if you say you work 50 weeks a year,
right.
so 425 divided by 50, you're looking at 8.5 days per week.
Right. So
Eight and a half.
I need two full-time hygienists.
Right.
So that's the way you can look at it mathematically. Another way you can look at it is we always like to see new patient callers within 3 days, ideally, or a week at the longest. And by adding hygiene days, you're going to be able to see more of those new patient callers. So another way to look at that, for sure. But yeah, Doctor, I'm encouraged for you to grow you got to close that back door. And I want a third of the total office production coming from hygiene. A third of the office production. So all that motivation should help you grow your hygiene department for sure. Hey, thanks so much for watching this video. And if you found it helpful, leave a like, subscribe, and click the bell button so you'll be notified of any time we upload future videos. I think you'll enjoy our coming content. Thanks so much.